Good morning, student. As in continuation with chapter number 5. So today in this chapter we will discuss about rehabilitation of mental ill. Mental ill means, children, a person who suffer from a particular disorders whose functioning is not appropriate according to the situations. So the treatment of psychological disorders has two components. First, it is a reduction of symptoms and improving the level of functioning or quality of life, whereas in the milder cases such as generalized anxiety, reactive depression, or phobias, reduction of symptom is associated with an improvement in the quality of life. So, in the cases of severe mental disorders such as schizophrenia, uh, schizophrenia, which includes different types of symptoms. So, the reduction of symptom may not be associated with an improvement in the quality of life. So, children, many patients suffer from negative symptoms such as they start developing disinterest in the particular environment or lack of motivation to do work or to interact with people. So, children, the term rehabilitation is the care that can help an individual to improve his abilities in his daily life. So, children, rehabilitation is given so that individual is able to do his work in a particular manner which does not interfere in his daily routine work, as well as rehabilitation is given with the use of different types of therapies. An individual is made a more productive member with the help of occupational therapy, helps an individual to develop social skills training, and vocational therapies. So these three therapies are important for a person to become a more productive member of the society. And with the use of this therapy, an individual learns how one has to behave in a particular situation. So children, in occupational therapy, the patient are taught such as candle making, paper bags making, weaving to help them to form a work discipline. Social training helps the person to develop interpersonal skills through the role play, limitation, and instructions. So, the basic objective to teach the patient to function in a social group, cognitive retraining is given to improve the basic cognitive functions of attention, memory, and execute functions. So, these are the major functions of these therapy. After the patient improves, vocational training is given wherein the patient is helped to gain skills necessary to undertake productive employment. And this is how an individual learns to behave in a particular situation, as well as with the help of training one learns how an individual can be a productive as well as help the other people in the society. So children, the rehabilitation is basically given so that individual can have command over his life and make his life more self-reliant, that helps him to live in a more sufficient. And the goal of rehabilitation is to help person learn how to care for body that now works differently, maintain a high level of health that avoids the secondary complications. The overall goal of rehabilitation is to help an individual to get abilities back and regain independence, but the specific goals are different for each person. They depend on what caused the problem, whether the cause is ongoing or temporary, which abilities he or she may lost, and how severe the problem is. So children, in this we discuss about the types of therapies that makes a person more productive member and how useful those therapies for an individual is. So kindly make a note of this in your notebook.